My mother was very clear about what she wanted, and we'd had a considerable discussion about that, and we boiled it down to 3 factors. Not going to hospital unless she really had to for comfort and pain relief, being surrounded by her family when she needed her family there and when she wanted a family there, and to be kept out of pain. Having that conversation with families is crucial if you want to get to the right end point for that particular family or that particular individual. What was really interesting about my mother and death was not that she was afraid of dying, but she was afraid of the process of dying. And I think that really came back to her experiences in Auschwitz, that for her death was not a natural thing. Well, the process of dying was not a natural thing. It was a traumatic, ugly, painful and revolting thing that was terrifying to her. So, and we had that conversation actually a couple of weeks before she died about that process, because it only became really clear to me in conversation that that's what was lurking here. It wasn't obvious at the time. And when we talked that through and we reassured her, when she reassured her about how we would manage that process, you could see she relaxed considerably about that. Once we identified those 3 principles, we saw the health professionals that have looked after my mother in the past, her general practitioner. We spoke with the hospice service in the Lower Hutt, Te Aomanga Hospice, and on our behalf they contacted the Wellington Free Ambulance about what my mother wanted should or when things were going to turn for the worse for her later in time. So we communicated that with those people. They documented those things, and when difficulties arose, as they did, everyone involved knew what mattered to her. A lot of clinical people aren't trained to have those conversations with patients and families. They feel quite a burden to intervene and do the things that they've been trained to do. So, disease is there to be actively treated, fever is there to be dropped, pain is there to be gotten rid of, fractured bones are there to be fixed, cancers are there to be chemotherapized. This is what we do to people, we treat diseases. Sometimes we've lost sight of the fact that we need to be treating people. Good communication's got benefits for everyone involved in the conversation. Certainly for the patients and families, they get the most appropriate care. For the clinician, it unburdens them to allow patients and families with information to choose the right thing for them. Often clinicians are very uncomfortable about foisting treatments because they think they should on patients and families. And clearly for the bottom line, patients and families, there's good evidence to show that they choose less expensive and less invasive options when there are a range of options and given the best information. So everyone benefits. I think it's pretty clear to most people that we only die once. It's pretty important to make it a good death.